Now for imaging of the ribs, you can do this at 48-inch SID, and you can do rib x-rays bilaterally or just a single side. It all depends on the x-ray order. I'm going to show you how to do bilateral ribs, and first I'm going to do the AP ribs. When you do the AP ribs, that's indicating that the injured area is in the posterior ribs. So we'll pretend David has a posterior rib injury here, so I'm going to do an AP rib, get both sides on, and do upper and lower sections of the rib. So first you want to make sure he is lined up mid-sagittal. And you want to make sure his shoulders are relaxed and that you do see light field about 1.5 inches above the shoulders. That way you're ensuring that you get all of the ribs in. Alright, next I'm going to reposition him here just to make sure it is mid-sagittal. Have markers indicating the right side, the left side. And then since we are interested in the upper ribs, we're going to have the patient take in a real deep breath, because what this does, it lowers the diaphragm and we're able to see more ribs above the diaphragm. So once we've completed our upper ribs, next I'm going to get an AP set of the ribs for the lower ribs. So what we would do is change out our image receptor, and then I'm going to move the IR down in the bucky. And the very bottom edge of this is going to be hitting at the crest. So what you want to do is palpate the crest and make sure that the light field bottom edge is at the crest, because we're only interested in the lower ribs for this one. Okay, again we want to mark our right and left sides, indicating the correct side of the body, and then just double check and make sure that your bucket tray is lined up. Okay, now this is for our lower ribs. You want to check mid-sagittal, and then for this we want to have the diaphragm at an elevated position. So we'll ask our patient, take in a deep breath, blow it all the way out, and then hold that breath out. And then once you take this exposure, they can breathe again. Now doing this lower ribs on the table actually helps that elevation of the diaphragm. So if your patient's able to get around pretty well, you might consider laying them down on the table for this one. That way you know that the diaphragm is getting up at an upper level so that you can see more of those lower ribs. Okay, now since we're doing bilateral ribs, I'm going to have to do bilateral obliques of those ribs. So I'm going to do the right and left obliques of the ribs. Okay, so I'm going to do his left side first. So I put my film in lengthwise because I don't need to catch the entire length or the entire width of the chest. I'm just going for the one side. So I'm doing this left side, and there is the left marker indicating that. Next, we're going to bring this arm out, and what this does, it brings the scapula out from the rib edge so that we can see more of the ribs. Again, I'm going to relax your arm here. Double check, make sure you can see light above the shoulder, and that's usually about 1.5 inches again. So once you bring that arm up, you want to check this longitudinal line. So you'll find the mid-sagittal point on the body in this lateral aspect, and you go about halfway in between that. So that would be our left oblique of the ribs. Now, something you do need to consider if you are using automatic exposure control, you may have to keep, here, step back into it, you may have to check that longitudinal line, because sometimes when you're halfway in between, it may cut off a little too soon. So you may be better off keeping that line more along that mid-sagittal point on the patient's body. So that is another option you can consider. So this is our oblique of the ribs. Some facilities may require that you go ahead and take one more exposure after this of just the lower ribs as well. Now I'm going to go ahead and do the right oblique of the ribs. So David will turn to the right side. Okay, and by the way, the obliquity of the body part is going to be 45 degrees. So your patient's going to be turning halfway. Okay, you want to check for this slight field, bring the arm up to bring the scapula out. Alright, check for the mid-sagittal, and you want to go halfway in between those two areas in your centering. Okay, so I'm just going to move it forward just a little bit. And then that is the obliquity of the right ribs. Okay,